back to NUR 236, skill number 2. Mr. Monroe's back here with us, and he has a tracheostomy. And today we're going to change his tracheostomy. And if you've never seen a tracheostomy, it's a surgical incision made into the neck to make their airway. This one's a two-piece one. It has an outer air piece and an inner piece. You need to clean the inner piece as that swirls around. And that's what you're going to learn to do today, and clean around the tracheostomy site. And then this is the outer aspect, and you're going to tie this around their neck to hold it in place. This little skinny device inflates with the 10 ml syringe and holds the balloon in place. That's done by the surgeon, or typical sometimes respiratory therapy. So, Mr. Monroe, we're going to clean your trach site today, and he agrees. If he's on oxygen or a ventilator and needs this done, we need to hyperoxygenate for 30 seconds prior to starting. And when you come to practice, I would leave your kit like this so you can fold it back over when you're done and just write your name on the outside, because you get one kit to practice with. But for today's sake, I'm going to peel it all off and discard it. And my little trash can. And when you're pouring your water or your solution, you need to always remember to have the label in the palm of your hand. That'll come back to haunt you in a couple weeks after you do this, because you'll have your skills final. And lid up. I'm going to remove my dirty gloves. And actually, before I remove my dirty gloves, I'm going to remove this pre-cut 4x4 around his neck. It'll have some possibly some sinus drainage on it. And then I'm going to discard my gloves. This one comes packaged like this. I'm going to move my gloves out of the way. Then I'm going to grab this towel in a corner. I'm going to know which side I grab because it's not packaged the best. Remember how to lay your towels. That'll come back to haunt you. Just like that. And you're going to, you don't want to reach over your sterile field, so I'm going to dump this on the right side. And then I'm going to sit this on the left side. And when I pour, because I put it over here, I'm going to pour on my left side, which is kind of tricky. And I like to fill 2 bins of water. 1, 2. Okay? And you're not going to, I didn't touch my sterile field. And my border is 1 inch. 1 inch. I'm going to set this on this bed next to me, so I have room to put on my sterile gloves. If you feel nervous about putting on sterile gloves after this week, come by and see me. We can always get you an extra pair to practice with. That didn't slide on the best. But I know that I can fix it when I put my other one on. That one slid on great. I think I just broke sterile field. Did I?
I don't think so.
Okay. If I did, I would get a new pair of gloves. I think I grabbed the inner side cuff right here. But I would get a new pair of gloves. Okay. So, we're going to have a sterile hand and a non-sterile hand. A contaminated hand. I'm going to unscrew this, and it's going to slide out nice and easy. You're going to bring it over here and let it soak. And then you're going to grab this brush. You don't want to clean your tracheostomy kit with anything else besides a brush, because if you use Q-tips or 4x4s, they can get stuck in there, and that would go in the patient's airway. And you're going to clean back and forth. This is my contaminated hand. This is my sterile hand. Once I'm done brushing, I'm going to sit it in the other basin to soak. Your textbook also mentions pouring water over there, but I've already moved my water over there, so I can't do that. You're going to not pat it dry, but let it dry. And you're going to say, Mr. Monroe, are you doing good? And he nods his head yes. If he was in the ICU or on a monitor, you'd want to measure his pulse ox and assess lung sounds prior to this. You're going to gently slide this back in, lock it into place. And now your sterile procedure is over with. Now with the clean water that you have, you can always pour it in the third one. You're going to take your Q-tip And you're going to scrub around his site, lifting this device up and scrub nicely around. And when I'm doing this, he still has his tracheostomy tube holder in place. Of course, my nose itches really bad. He has his tracheostomy tube because you don't want that dislodged. You don't want to take off the tracheostomy holder until you have the new one on. Okay, and then you're going to come over here and you're going to pat this dry. Okay, we got it nice and dry. And then you're going to take your already pre-cut 4x4. You do not want to make your own because the particles from the 4x4 could get in as long through his tracheostomy. Not be a good thing. The good thing about life is they make these inner cannulas. They also make them disposable. So you could just throw it away and slide a new one in. You don't even have to clean it. And now we come to the tie part. Luckily for me, he already has a nice commercially prepared strapped holder. But I'm going to use, I'm going to slip off a glove. I'm afraid he doesn't cough on me so I can get this through. Sometimes they're cut at an ankle so it goes in better. Of course this one's not. There we go. We're going to slide it through. And I'm actually going to walk to the other. I'm going to slide, Mr. Monroe, I'm going to lift up your neck. I'm going to slide this around him. I'm going to come over here and tie it. And when I tie it, I want 1 finger's width in between the neck and the tie. You don't want to put it. I would recommend not taking off your gloves, but I just don't want to go in. Mr. Monroe, I'm going to put my bed rail down. You scooted to the other side of the bed. You must have liked me earlier. The best thing about nicely commercially prepared devices. Okay, so we got that. You're going to tie this in a bow, not a knot, because what if he goes into respiratory arrest? And you're going to have 1 finger's width between you and the patient. And now you can take off his nicely prepared. This commercially prepared device is a little big on him. But it could be adjusted through the back of his neck because there's Velcro right there. So you can make it shorter or longer for your patient. So you will have to demonstrate 1 finger's width below. He has his nice new cannula on with his pre-cut 4x4. And his oxygen sats 98%. And you're going to ask Mr. Monroe, how are you doing? And Mr. Monroe tells me that he's going to have a great day today because he has a nice clean trach. Sometimes trach care is ordered daily, sometimes it's ordered every other day, sometimes it's up to the patient preference how often they want it changed. But if there's a lot of mucus, it needs changed PRN also. Thank you for your time.